this has really shown us the importance of prevention and pandemic preparedness. And so, even when we had variants that were starting to spread throughout the country, our genomic surveillance programs in the United States were well behind those of the ones in the UK and other countries. And so, for a lot of it, it's not really been a matter of if the virus is here, it's really a matter of if we are detecting it and the fact that it is here. And we'll be dealing with this a lot, especially with variant and especially with a large number of people that are still unvaccinated in the country. I'd worked on the WHO's independent panel for pandemic preparedness and response, and a lot of the research that we were doing essentially was suggesting that, in fact, those early detection systems are really, really critically important. I mean, it was challenging enough because we were in flu season, and so we were dealing with a novel respiratory virus that initially it was hard to tell what was going on, and if it in fact was a novel disease, a novel epidemic that was spreading in Wuhan. And so I think that as we do more studies like this and look at blood samples from January in different places of the world, we'll find that actually this infection was spreading in a lot of places earlier on. And one of the challenging things with SARS-CoV-2 is that you spread it with no symptoms initially, and you're most contagious around the day when you have symptoms. And so this makes epidemic control here very challenging. And if you talk to a lot of people I've talked to have said, looking back in January of 2020, I had symptoms that now I think were COVID. So, as we get more data, it will help us get better at pandemic preparedness and preventing this from happening again.